Welcome to this month's Ask Asbury. I'm Dr. Sue Paul, Senior Director of Wellbeing and Brain Health at Asbury Communities. March is my favorite month. It is Brain Health Awareness Month. And today we're going to talk about the importance of taking care of your brain, not just for your memory, but for your overall health. I'm pleased to welcome my friend Ryan Glatt today, who will share some key insights. Stay tuned because every time I talk to Ryan, I learn something new, and I think you will too. So Ryan, can you tell the gang a little bit about yourself?
Yeah, happy to. And thank you for having me, Sue. So, my name is Ryan Glatt. My background is in exercise science. I have a master's in neuroscience. I'm a PhD candidate in health and human performance with a focus in gerontology. I'm a board certified health coach and a medical exercise specialist. So, my main goal is to partner with individuals, families, professionals, and help to navigate all the things that can help prevent dementia, slow cognitive decline, and improve brain health in older adults across the cognitive continuum.
Yeah, that's why we're best friends because
That's why we're besties. Yeah, I
we
mean,
share that
there's so
mission. Yeah.
many there's so many incredible things that we can do to improve our brain health, and common knowledge is not common practice. And I have conversations all the time with people. Most people aren't surprised to know that exercise is good for their brain, but if exercise is medicine, they don't know the specific dosages like they would have for medicine. So we often talk about that. And then once we have that information, it's really about creating behavior change that's personalized in order to actually take the medicine that has been shown to be good for our brains.
Yeah. Yeah, I'd like to give Ryan a plug because you do take the general recommendation, exercise is good for you, and you bring it down into specifics because that's what makes things actionable, right? Like,
Absolutely. Yeah.
so
And
you,
what I often find is that hasn't been done. A lot of people are talking about that exercise is good for the brain. A lot of people are talking about 150 minutes a week or more, and everyone's heard that usually. Maybe about 80% of people I talk to have heard that, but then maybe only 10 to 20% of people are actually doing that and meeting the minimum recommendations. And so it's very interesting to see what that gap is between knowledge and behavior change.
okay, I have a question for you.
Sure.
What are the general benefits of exercise on the brain?
Yeah, I think this is good to start with because people usually have some sort of anticipation of why exercise is good for the brain. And I think most people would think and theorize, and it is true, that exercise is good for the brain partially because of increased blood flow and increased oxygenation. This has also led people to believe that the best type of exercise for the brain is aerobic, which is not entirely true. I wouldn't say it's the best type, and there really is no best type. It's really a combination of things that are really important for brain health, which we'll talk about. But the first thing is blood flow. And this is happening both at the micro level, meaning like little tiny vasculatures in the brain. We have about 400 miles worth of vasculature in the human brain, which is quite a lot. So it's important to take care of those roads and pathways. But we also have arteries and larger vessels that need to be nourished, and brain cells, which we call neurons, require nutrition through oxygen and the delivery of substrate through our blood. But then there's other things that are happening. There's increase in brain activity. There's improvements in mood, the increase of certain neurotransmitters and brain waves being elevated. There's the release of what's called growth factors, brain-derived neurotrophic factor, vascular endothelial growth factor, and all these like precursors to what we now know is probably behind having a healthier and robust brain. And probably most importantly, aside from the things happening in the laboratory or on blood tests or in animal studies, I think people are most interested in improving how they feel, both from a mental health standpoint, even if you don't have a mental health condition, just improving your stress reduction, your feelings of anxiety or depression, improving your stress response, but also improving cognition. So I think most people, when they exercise afterwards, they feel sharper. And that's what's called an acute benefit. An acute benefit means it's short term. And you have better mood states for up to 24 hours after exercising, whether that exercise is 5 minutes or 90 minutes. And you usually have improved cognition. You feel sharper for up to 2 hours or more. And it depends on the exercise and how long and how intense and stuff like that. But by and large, those are some of the benefits of exercise on the brain. But in order to keep those changes more chronic or more significant, we need to do them again and again and again. And so research has shown that when we do exercise interventions for about 8 weeks at the minimum to about 12 months, that's usually the range. The average length of an exercise research study on brain health is about 12 12 weeks or 3 months to about 6 months. And
Mhm.
research shows that depending on the type of exercise and what's measured, we can improve certain aspects of cognition. Sometimes that's attention, processing speed, aspects of memory, but also improve the function, meaning the electricity of certain brain regions like the frontal lobe, which is responsible for planning, organizing, short-term memory, and also the hippocampus, which is the area of the brain responsible for memory and learning that a lot of people have heard about as it relates to age-related memory changes. So what research also shows is that we can actually increase or at least protect the size of these brain regions individually. So some research has shown that we can actually increase the size of the hippocampus, that area responsible for memory and learning, after doing aerobic exercise and resistance training for 3 to 6 months. Research also shows that we can protect the amount of gray matter, the tissue in the brain that declines over the lifespan normally, and kind of slow down that decline, and in some cases even improve the total amount of gray matter in the brain. Of course, this is going to depend on the individual, what's done, the age, their impairment, all sorts of things, as well as many different variables in the intervention. But to be able to grow the brain, or at the very least improve brain function in such relatively a short amount of time with an intervention, is pretty incredible. And I feel like even though people know exercise is good for the brain, I don't really think people realize the significance of those results.
No, there's no pill that can do that.
No pill that can, and actually, yeah, so people call exercise a poly pill as a metaphor because it's acting on so many different levels. And there's really one, per your point, there's no medication that can do that. Um, and especially within a singular mechanism. So there's so many multiple things that are acted upon when exercising or as the result of an exercise intervention. And some people have called exercise a neuro poly pill because it's acting on so many different levels of the brain.
Yeah, yeah, this is why I love it so much. And we're going to talk later about how to implement those changes because people for some reason don't like to do it. And it's free and it's good for you. And it's the best thing out there, really. We'll get to
Absolutely.
that.
Yeah.
Uh, all right, Ryan, your next question. What are the benefits of different types of exercise? So you mentioned aerobic exercise and resistance exercise. So what are there specific benefits from one type that will affect a certain brain function?
Sure. Yeah. So aerobic exercise, I think, as we discussed before, will increase blood flow, increase the release of growth factors like brain-derived neurotrophic factor and vascular endothelial growth factor, both of which can kind of help with increasing the number of neurons in certain areas of the brain, like the hippocampus, and or increasing the amount of brain activity and blood flow in certain areas. With resistance training, which is strength training, and lifting weights and things like that, we can also improve muscle mass, which is very much correlated to brain volume and brain health. We put out a study at Pacific Neuroscience Institute showing the correlation between grip strength, which is indicative of kind of overall strength in some cases, and hippocampal volumes. And many other studies have correlated leg strength to brain health. And so strength and muscle mass, which is very important as we age, has been correlated to various aspects of brain health as a correlation. But more directly, when we do lift weights, we can release a growth factor called irisin. And irisin is named after Iris, which is messenger to the gods, which I think is an interesting metaphor because it gets released from the contraction of skeletal muscle tissue, and it goes through the bloodstream and crosses the blood-brain barrier and goes to the brain and does the brain to survive, function better, and do good things. But research has also shown that resistance training can really help the function and structure of our frontal lobe. Our frontal lobe is right behind our forehead. It's the whole frontal third of our brain, and it's responsible for what's called executive functions, things like planning, organizing, short-term memory, impulse control. And it impacts that frontal lobe in a way that resistance training does a bit, but not entirely the same. So there's some overlap in terms of the brain regions and functions that different types of exercise affect, but there's also like more enhanced benefits that seem to come from different types of exercise. So aerobic exercise seems to affect the hippocampus, the temporal lobe, seems to increase blood flow, is great for the heart. Whatever is good for the heart is good for the brain. Resistance training helps with muscle mass, skeletal mass as well, like bone mineral density, which is really a concern for people with osteoporosis, osteopenia, but also helps various aspects of brain health. And then there's a third type called neuromotor training, which a lot of people don't really talk about. Usually people think just aerobics and they kind of stop there. Yes, resistance, but then what is this neuromotor component? So neuromotor is anything that requires coordination or movement in response to a stimulus. And there's kind of two categories of neuromotor. There's mind-body exercise, so that's your Tai Chi, which is really evidence-based for improving cognition and balance, Pilates, yoga, and other related mind-body activities, all of which have different levels of evidence for improving aspects of brain health. Then we have sort of the skill-based activities, your racket sports like your tennis, pickleball,
Wow.
badminton, table tennis, things like that. And then we have things like dance, which is very evidence-based for improving cognition and balance, and things like martial arts. So we have aerobic, we have resistance, we have neuromotor. The way neuromotor impacts the brain differently than aerobic and resistance is that usually there's some sort of a learning or coordination or a skill involved in the neuromotor component. And that kind of acts directly on the brain because it's very cognitively stimulating, but also it acts on areas of the brain like the cerebellum, which has been called the little brain. It's in the back of the brain, as well as the basal ganglia, which is in the middle of the brain and sort of responsible for dopamine production, is the area of the brain affected in Parkinson's disease. And that's why research has been showing that neuromotor activities like boxing, dance, table tennis are really good for Parkinson's disease. But in the non-Parkinsonian brain, it's also really good for these regions, and at the very least requires that you really have to pay attention and think as you move. So we really want to have a combination of these three categories of aerobic, resistance, and neuromotor.
Yeah. That's awesome though, because a lot of people, you're right, a lot of people don't worry about that neuromotor side of things. I went to the gym today.
Yeah,
Well, let's up your game a little bit and either try something new or play the thing
right.
you're good at. You just play it harder, or play with
Yeah,
people that are
get better at
similar
it.
from you.
Do
Yeah,
something
get
new.
better at
Learn a new routine. See if you can recall the choreography. Go from tango to foxtrot. Really stimulating our brain with new things. I mean, I think that's so important with exercise because when I talk to most people about exercise, I say, "What do you do for exercise?" And they say, "Well, I walk." And then the first thing I do then is differentiate unstructured physical activity versus moderate intensity or greater exercise, which is
it.
structured and more focused on a specific outcome. It's scheduled, it's got parameters versus just walking, which is still good for your brain. Research has shown that people who walk more have better brain health, but that alone isn't going to help us prevent dementia and cognitive decline as much as we like to.
Mhm.
And when people know the difference between walking and more intense exercise with greater variability, we tend to do more of that. But unfortunately, we get away with thinking that walking is really the only thing we need to do, or it's a replacement or something that's equivalent for what we're talking about here with a multimodal exercise program.
Right, right. I walk the dog. Well, yeah, but we could
That's
do
physical
better.
activity. Yeah. Yeah.
Okay.
There, if there's not an exercise class on dog walking, it's probably not exercise. It's still good for you though. I don't want to villainize that, but
Right,
it's just the conversation I'm often having is like, well, let's increase the intensity, frequency, and variety of what you're doing. And we can make this fun too. It doesn't have to be this super arduous, really unenjoyable thing. In fact, the challenge is negotiating to figure out how to make this enjoyable.
right. That's the
Yeah,
coaching aspect.
that's the coaching aspect. Absolutely.
All right, next question. What are the benefits of combining exercise with cognitive training?
Absolutely. So we talked about those neuromotor components. We talked about racket sports, dance, Tai Chi. All these things are more cognitively demanding. Whereas with aerobic exercise, you can be on a bike, a treadmill, an elliptical, you can watch the news. You don't really have to pay that much attention. It doesn't mean that it's bad for you, but we're just comparing the cognitive demands of one versus another. Typically, the more we use our brain, the better it stays intact. So kind of the use it or lose it hypothesis. And just like we can measure physical load on a scale of 1 to 10, 10 being the hardest, 1 being the easiest. So a walk might be a 3 or 4. Again, the treadmill or the bike for 30 minutes might be hopefully maybe a 5 to an 8, depending on how intense you're going out of 10. We can also look at cognitive demand out of 10. So on a scale of 1 to 10, 10 being the most cognitively demanding, 1 being the least, how difficult is walking? How difficult cognitively is going through that list of exercises from your physical therapist? And typically those are lower cognitive demands. So the first thing is just increasing the overall cognitive demand of the activities that you're doing. And certainly if I'm taking a dance class and I've never learned the dance, I'm going to probably be at like a 6 to 8 out of 10. It's going to be mentally challenging. And we usually avoid that because we say, well, I'm not good at that, so I'm not going to do it. And to that, I say exactly. You're not supposed to be good at it. You're supposed to be
Right.
challenged. if the goal is cognitive stimulation. So that's the first paradigm shift. The second paradigm shift is that these are open skills, typically. Open skills means that they're more unpredictable, whereas closed skills are very predictable. So if I go on a treadmill or an exercise bike, that's called a closed skill because I know what's happening. I know I'm in control. But if I play a racket sport, like when I play tennis or table tennis, which is my favorite neuromotor activity is table tennis, it's unpredictable. And that's one of the reasons I enjoy it is because I have to really pay attention and adapt to what's going on. Those open skill activities act on certain cognitive processes that cognitive closed skills do not. It doesn't mean that closed skills are inferior. We need them. But these open skills have this unique benefit because they're more cognitively demanding. The third paradigm shift is, well, how can we make exercise more cognitively demanding? And there's two kind of things that we can do for that. The first one is called exergaming. And exergaming is like the Nintendo Wii, Dance Dance Revolution, things people may or may not have heard of, but they're video games that require you to move in order to participate with it. There's also something called clinical exergaming, where there's different devices that are specifically targeting aspects of balance or cognition like memory at the same time. So you might be marching in place while playing a memory game or stepping in a different choreography, kind of like dance, but in a video game. And these clinical exergames have become more and more researched, more and more popular. Asbury has a whole brain gym program incorporating these technologies, which is amazing. And then we have dual tasking. The most common example of dual tasking is talking while walking. And on one hand, dual task performance declines with age, but on the other hand, dual task training can actually improve that dual task ability. And not only can that help with fall prevention, but it seems to also enhance with frontal lobe functions like executive functions. So an example of doing this would be walking while counting backwards. Not my favorite example because that's a test that we do to test dual task ability and also who wants to do that for fun. But there are physical therapists, occupational therapists, personal trainers that are qualified that can help people engage in dual task training as well as clinical exergaming interventions to actually significantly target cognition. And when I say significantly, I don't mean improvement because that will depend on a lot of different things, but I mean really upping the cognitive load that is specifically targeted towards an individual in an exercise session. So there are a lot of ways to do that. If someone's going to do something on their own, I recommend participating in a more novel, challenging, and enjoyable neuromotor activity like a dance or a Tai Chi or a martial art, because that has a lot of evidence. And then if you have access to exergaming or dual task programs, as many people do at Asbury, I suggest people consider doing those as part of their exercise program as well.
Yeah. The nice thing about exergaming is a lot of those technologies keep score, so you can track how you're doing and you can, just trying to improve your own performance. It gives you
Absolutely.
objective feedback, so like, I felt like I did better today. It's like, no, I actually
Yeah.
did better today. So, but
Yeah,
not
that
everybody
gamification is really powerful.
is. Yeah.
Absolutely. We have that in sports too. That's
Uh-huh.
why we keep score in tennis. So that's gamification too.
Even
But
having a stopwatch and trying to walk a little faster,
sure.
or,
Yeah, there's
you know,
so many ways to measure different performance measures. That could be time, that could be calories, that could be steps. I think that's why
steps is a great
counting
one.
steps is so
Right.
popular. Is it's that one metric that people were really motivated by. I just joined a gym where it gives me points for every workout, and I know what they're doing, and I'm motivated by it. I love it. It's like
Right.
these points seem arbitrary, but they're motivating. It's quite interesting. Yeah,
Gamification is a real behavior, you know,
it really is. Yeah.
secret sauce, tool.
Yeah.
But we
It,
can
it
talk
has
more.
to work for the individual. Like there's something called superficial gamification. It's like, Sue, I'm going to put you on a leaderboard. And like for me, that would just like not motivate me and actually demotivate me. But if
Right.
there's a meaningful metric to you, then gamification I think can be very powerful.
Right. Right.
Yeah.
Okay, I have another question for you. Um, let's talk about the scary word, but what components of an exercise program are best suited to prevent dementia?
Absolutely. So we've talked about the three different types: aerobic, resistance, and neuromotor. Certainly doing any exercise more than none is going to be good. Doing more than one type of exercise is better for dementia prevention than just doing one type of exercise. Meaning, if I do aerobic and resistance, that's going to be better than just doing aerobic. The next thing, so that's kind of the types, right? We call that a multimodal exercise program, doing more than one. Then there's the minutes per week. And minutes per week is a little weird because the researchers are like, you should do 150 to 300
Right.
minutes per week, but then normal people aren't measuring anything in minutes per week. So it's kind of weird to think about that, but the English version of that is 2.5 to 5 hours. But let's break that down by day. Let's say I do 3 days a week, and if I do 45 to 60 minutes, I'm hitting that minimum of 150 minutes a week. If I do 5 days a week for 30 minutes, that's 150 minutes a week. Now, that's the duration and frequency. Duration is how long my sessions are. Frequency is how many times a week I do it. Then there's intensity. And this is the big one that I think people miss is intensity. It's that 1 to 10 scale. Those 150 minutes should be moderate intensity or greater, meaning they should be anywhere from a 6 to an 8 out of 10, unless we're doing a mind-body exercise like a yoga or Tai Chi, which still benefit cognition without getting your heart rate up. They even benefit blood pressure without getting your heart rate up. So those are good, but you have to have about at least 150 minutes of moderate intensity or greater. And you can get your heart rate up doing resistance training. You can do circuit style training. It doesn't have to be high intensity, but moderate intensity or greater. Now, you can get away with 75 minutes of high intensity per week, and you can split that up any way you want. And people say, well, what's the best? I say, there is no best. It's just what works for you. It could be 3 days a week. It could be 5 days a week. It could be 7 days a week. But based on the frequency, we're going to have to adjust the duration to make sure you hit at least those 150 to 300 minutes. So we have intensity, which we just talked about, moderate intensity or greater, unless it's mind-body exercise. We have duration, which is how many minutes it is. We have frequency, which is how many times a week am I doing it. And then we have type, which is what kind of exercise I'm doing. So the ideal exercise prescription for dementia prevention or slowing cognitive decline would be to have at least 150 minutes a week of moderate intensity or greater, to do a combination of aerobic, resistance, and neuromotor, and to make sure that we're doing it 3 to 7 days a week. So it's actually quite a broad range, and that allows people the autonomy and the flexibility to create their own version of that.
Right. It's just part of the human existence to move and think throughout your day, and do
For
some hard
sure.
things throughout the day and get tired and work up an appetite and all those things that are just part of normal function. And we have to actually invent this and write the rules, which is just so like such an obvious thing. It's what we should be
Right.
doing,
Right.
you know?
Yeah. And as a doctor of occupational therapy, you know that the ability to move throughout our society and our life to physically and mentally function at the same time are so integral to who we are, just as you said.
What we should just be doing anyway. One of the things I found, especially in the senior living world or any senior living, I would say, wherever older adults, go through their exercise programs. They go every day to a 30-minute exercise class or, a structured
Great.
event. It's not 30 minutes of moderate intense exercise. It's maybe 5 minutes with little pink dumbbells,
Yeah.
or like raising their hands up and down. It's movement, but it's not exercise. It's not really getting their heart rate up. It's not stimulating their brains really.
Or rather, it's not moderate intensity exercise, it's low intensity.
Yeah, exactly. It's low intensity and it's kind of going through motions. It has its benefits, but it's not checking the box on,
On the intensity part.
on the
Well,
intensity.
I hear you, and I think a lot of older adults are infantilized. Instructors that are not qualified maybe are afraid to push them, or maybe they don't think they can or should be pushed. But everyone has their own capacity, and typically we need to explore those capacities a little bit more. Now, I would argue that those 30-minute classes of low intensity, typically seated exercise, those are not bad. I think those are better than nothing. And even if someone's walking 5 days a week, I say that's a great start. That's a warm up to your ideal routine. At least we're warming up to it. And I say, okay, what's the variable? If we could just adjust one variable to get you closer to a more ideal exercise program, what would that be? And so if they are attending a 30-minute exercise class every day, and that's the one class that they're doing, and let's just assume it's the same class, and they're going in terms of frequency every day or 5 times a week or what have you. They're doing 30 minutes. So everything's checking out. If they have some resistance in there, that's good. If they have some movement, it could be aerobic. So in this case, the main moderator or the variable we need to change is intensity. Okay, well, how can we do that? Can If this person knows, can they go to the instructor and say, I like to use a heavier weight. I'd like to move faster. I'd like to stand up instead of sit down. Or can we train that instructor to be able to provide that? And or can they explore alternatives instead of or in addition to that class? So are there classes that they can go to that are more intense? Or is it not a class? Maybe they go to a gym and they do it themselves. Or maybe they go to a trainer and they get some assistance with that. And so there's multiple ways to adjust it. It's just a negotiation. With the people who walk 5 to 7 days a week and they don't want to do any other different types, I say, well, we can increase the aerobic demand by getting your heart rate up and walking faster. And assuming there isn't an increased fall risk for that, yeah, that could be one way of doing it. If there is, maybe we need something more controlled, like an exercise machine. So there's a lot of ways to negotiate it. And usually people have multiple aspects of this type of programming that they are doing well. It's just adjusting it to get them to do it better.
Right, right. Okay, last question for you, Ryan. Then I'm going to let you go.
Okay,
What does an example of a weekly brain healthy exercise program look like?
absolutely. So I think when people say you should do aerobic exercise 150 minutes a week and resistance training 2 to 3 times a week and neuromotor training 2 to 3 times a week, you start to realize, wait a minute, there's not 9 to 12 days in a week, and I can't just dedicate my full time to this, right?
Right.
So I empathize with that. I am also, it's hard to believe, but I'm also a human being. So are you. We only have so much time in a day where we can actually do this stuff. So I say, okay, there's a lot of ways to configure this. Let's just assume you want to do as little frequency as possible. No problem. 2 times a week, you can go to the gym for an hour. 30 minutes, you do aerobic exercise. 30 minutes, you do resistance training. Already you've checked off those two things. And let's say you add in neuromotor by going to a dance class or a racket sport. That will take you to roughly 150 minutes a week. You'll have the aerobic demand, especially if we set up that resistance training in a circuit. You're getting resistance training twice a week and you're getting some neuromotor. Great. That's a good program. That's kind of like the minimal investment of time you could do to get all the boxes checked off. Neuromotor, aerobic resistance, 150 minutes, moderate intensity or greater, so on and so forth. Let's say you're more motivated though. You want to go 5 days a week. You want to dedicate to exercise. Okay, give me 30 to 60 minutes, 2 to 3 days a week. Do something at the gym with resistance training where you can't lift more than like maybe 12 repetitions for about 3 sets. And then maybe, and of course, major muscle groups, legs, arms, back, chest, things like that. And then you could either set that up in a circuit fashion where you're getting your heart rate up, and or you could do some traditional cardiovascular training of your choice. That could be swimming, that could be an aerobic exercise machine, that could be a variety of things. So let's say that's 2 to 3 days a week. The rest of the other days a week, let's say it's 2 to 3, depending on the configuration, you pick 1 to 2 neuromotor activities. This could be a yoga or Tai Chi. This could, for 1 or 2 of those days, and for the other 1 or 2 days, you could do a racket sport or a dance type of class or something similar. So I give people that kind of option. So in summary, a more moderately involved program would be 2 to 3 days a week in the gym doing aerobic and resistance, 2 to 3 days a week doing some kind of neuromotor exercise. But let's say someone's willing to exercise every day, 7 times a week. Okay, let's say Monday, Wednesday, Friday, you go to the gym, you do your resistance training and aerobic combination. Tuesday and Thursday, let's say you go to a Tai Chi class, and on the weekend, you could do dance and walking. Okay, we're doing something every day. We're checking off all the boxes. We're getting the minutes. We're getting our heart rate up there, and we're good to go. So it could be 3 days a week to 7 days a week. And if it's less than 3 days a week, or if it's less than 150 minutes, that's okay. We just have to aim to eventually get to greater frequency or duration. And then we also build in this very weird foreign thing called self-forgiveness and self-kindness, where if we miss a week because we're sick or it's the holidays or we don't feel like it or we need to adjust, that's okay. This is a lifestyle. It's not a sprint, it's a marathon.
Exactly.
And so we just got to build up over time and adjust accordingly.
Well said, Ryan. I appreciate that bit of grace that you grant us at the end.
Again, we're all human. I think you and I have also had those weeks where we just don't
Oh,
exercise at all. We're super overwhelmed. We're super stressed. Things are going on in the world. It's the holidays, whatever. And
yeah,
everyone goes through that. So we have
yeah,
to give that grace to ourselves and others.
for sure. Well, Ryan, I want to
Absolutely.
thank you because I always love these are my two favorite things, talking about exercise and brain health because they, and preventing dementia and slowing the cognitive decline. And because I have seen both anecdotally and now in the research that
Mhm.
this does actually have an impact. It does actually
Yeah,
exercise have a profound
absolutely.
impact on cognition, independence, quality of life. These things really matter. And exercise does not have to be hard. It does not, it may have to be moderately intense, but it doesn't have to be unenjoyable. We can build in those periods of grace and forgiveness, just like you said. But if you
Right.
make it part of your lifestyle, then, you're just serving yourself in a way that is going to pay you back,
Exactly.
way down the road too.
Exactly. So I think based on this conversation, if you're listening to this, just pick one of those variables that you're going to modify for now. Is it variety? Just, between aerobic resistance and neuromotor, pick one that you're not doing or not doing enough of and do that more. Is it frequency? If you're exercising 3 days a week, can you take it to 4 or 5? Is it intensity? Can you take it from a low to a moderate or a moderate to a high at least a couple days a week? Is it duration? Can you go from 10 minutes to 20 minutes or 20 minutes to 30 minutes? And so usually we start with one of those modifications. And usually it's a cascade effect where modifying one thing leads to a bunch of other things.
Mhm. Fantastic, Ryan. Well, thank you so much for joining us. I
Of
know
course.
our audience really appreciates your input. You'll
My
be hearing
pleasure.
from me again very soon. To everybody else, I want to thank you for joining us. Be sure to check back next month for more tips on how to prioritize your health. Until then, take care and keep your brain healthy and happy. Thank you.